Good afternoon, everybody. Welcome to another live Q&A. Here to answer any questions you may have about COVID, the coronavirus, the vaccine, boosting your immune system, whatever it is to empower you to be able to thrive and live and enjoy your life, even in the midst of a pandemic. So I'm here. I'll be here until about 12:30 to answer any questions you may have. So feel free to type in your questions, and I'm here to answer your questions. Welcome, everyone. Welcome. I'm here for you to pick my brain. Hi, everywhere. Welcome to live Q&A. You guys got any questions? I know last week I couldn't get to everybody's questions. So if you're back today, whatever question you have about coronavirus, the vaccine, what you can do to boost your immune system, whatever questions you may have, I'm here to answer your questions. And like I said, empower you to live and thrive in the midst of a pandemic. Because truly, we don't have to die at all whatsoever. We don't even have to be sick. Greetings, Glenda. Greetings, Esther. Hello. Thanks for joining. Any questions? Anything come up over the week? Hello, Brenda. Thank you so much for joining. Hello, Sunny Days. Hello, Monique. Hello, Forgiven. I like this song that's playing. It's saying "Peace be still," and one of the lyrics or whatever says that I don't have to fear the storm because God is greater than its roar. So peace be still, and let faith rise up and believe. Is that a word for this season or what? All right, so I got some questions coming in, so I turn off my jams. As soon as I figure out how to do it. Here we go. All right, so we have a question from Sherry Allen Reeves that I have tested positive and experienced lung problems. Should I take the vaccine in 90 days as recommended? No, you should not take the vaccine at all whatsoever. Some of the things that is happening with the vaccine, of course, I don't know if you know about all the complications that people have been suffering, but lung complications is one of them. And not only that, you tested positive before, which means you have your own antibodies already. So if you think about it, the whole purpose of the vaccine is to give you some antibodies, or where your body can produce antibodies, should I say, to give you some protection for a period of time. So if you've already tested positive, you already have antibodies, therefore you definitely don't need the vaccine. So I would say no, stay away from it. It says, can you catch COVID from someone who gets the shot? Funny you said that, right? So I would say yes. And the reason being, because these vaccines are not 100% effective. So just because someone gets the vaccine, that does not grant them 100% immunity from catching coronavirus. So even if they got the vaccine, they can still catch coronavirus and they can still transmit the virus to other people. Judah said, good morning. Good morning, Judah. Your wife tested negative, but she still has a cough. That's not, she tested negative, but she has a cough. So just understand that coronavirus is not the only virus out here. So people can have a cough for a lot of different reasons. People can have a cough for acid reflux, can make people have a cough. People can have a cough just from sinus drainage. So having chronic sinuses and the drainage is draining the back of your throat, creating what we call postnasal drainage. That can create a cough. People can have a cough if they have underlying respiratory situations like asthma, bronchitis, or COPD. And then just say if your wife had a common cold, because it's still cold season. Say she had a common cold, it's not uncommon that after she got better from the cold, still have a residual cough. And that's what we would call acute bronchitis. So just because it's not coronavirus, that doesn't mean it couldn't have been anything else out there. But cough can be secondary to a lot of different things. So not just coronavirus. It says some of our people seem fine after taking the vaccine. Will there be problems later for them? So I don't want to say blanket 100% everybody's going to have problems. Of course, we don't have any long-term data to substantiate that. So some people, so even going back to the studies that, or the clinical trials that Moderna and Pfizer submitted to the FDA to get the emergency use authorization. You had some people who were dying once they got the vaccine. Some were getting heart attacks. Some were having strokes. Some was having pulmonary embolism. Some developed autoimmune disease. Somebody developed cancer. So that wasn't everybody who took the vaccine, but it was a substantial number of people. So although they may feel okay right now after taking the vaccine, that doesn't mean that they'll be okay 5-10 years later down the line. There is no long-term data. Like I said, the mRNA vaccine is a new technology to the point of where it's been used on this many people. So it's new technology. They don't have long-term data from it, but based on how the vaccine itself works, I can guarantee you that those who look like they're okay right now will have some complications in the future. So like I said, I advise everyone to stay away from the vaccine, whether it's from Moderna, Pfizer, Johnson & Johnson, or AstraZeneca. Stay away from them. Amen. No weapon formed against us will prosper. That is the word of God, and it's the truth all day, every day. Hold on, I'm trying to catch up. So Judith said she was wondering what can be done. She tested positive on the 20th of January, and she had COVID phenomenon. So she tested positive. So what we're saying is that people who have the virus should take about 2 to 3 weeks to exit the system. And some people have residual symptoms, that may last, a month or 2 months afterwards. And I mean, we've even heard some people, especially with the loss of sense of taste and smell, where they've been noticing that, it's been months and they're still haven't recovered that fully. Some of the things that I can say that she can do in the meantime, because any viruses, will cause inflammation in the body. Take some anti-inflammatory type of supplements. So things like omega-3 with EPA and DHA in it. These are the particular acids that are actually excellent for inflammation. So get some omega-3 with EPA and DHA. I will also advise her taking some magnesium as well too. Magnesium is excellent for neurological function, for muscle function, as well as combating inflammation. And the other thing I would advise is taking the vitamin D, the quercetin, and the vitamin C. So start taking those things. Stand away from dairy because dairy is very pro-inflammatory. Dairy can also increase mucus production, which can in turn, increase the risk of having sinus infections and other type of things that can contribute to the cough as well too. Drinking plenty of water is some other things that I would recommend she do as well. Is hydroxychloroquine still banned for use in COVID patients? You're welcome. Thank you as well for your time of being on the Q&A. In America, we're still not allowed to prescribe it. Every other country around the world, like I said, in some countries, they sell it over the counter. So other countries, they have access to it. But here in America, they're still not allowing us to prescribe it. So yes, it's still banned for use in COVID patients, unfortunately. It says, what can we do to combat the neuroimmune attack on the brain and the nervous system? Majority of that is all inflammatory mediated. It's an inflammatory mediated response. So like I said, again, doing things anti-inflammatory. So we have to take a look and see what causes inflammation and what can contribute to that immune attack that we see. We look at it, talking about dairy, and I'm gonna keep saying anti-dairy, okay? So dairy causes inflammation. Gluten products. So gluten products is anything with wheat, barley, and rye. You usually see gluten in products like bread, baked goods, pastas, those types of things. So for some people, not everybody, but for some people, gluten can be an issue and cause inflammation in the body. The other thing is if you have allergies to something. So if you know I know people love shrimp, but unfortunately, a lot of people are allergic to shrimp. So stand away from things that you know you're allergic to, because if you're allergic to something, that's going to trigger an inflammatory response in the body as well. So those are some of the things there. And then stress actually causes its own level of inflammation, chronic stress over time. So making sure you're managing your stress is important. Other things is doing, like I said, taking the supplements that we know help with inflammation. Your magnesium, omega-3s are awesome. Turmeric is also really, really good as well, too, with inflammation. So those are some of the things that you can combat. And when you're talking about the neural system, the neurovascular or neurological system, another thing that's important to have a healthy neurological system is the B vitamins. So making sure you got adequate amount of vitamin B12 and adequate amount of folic acid, because when those numbers are depleted, it starts damaging the nerves. So it definitely impacts the neurological system. So like I said, staying away from stuff that cause inflammation, taking the supplements that we know combat inflammation, and then also, like I said, the B vitamins, which are excellent for healthy nerve function. How long do you have immunity after you've had COVID? Well, that question is, or the answer, should I say, is still really to be found out, because we truly don't know. We know for certain that at least a good 3 months. At least a good 3 months, the antibodies will still be present. But in regards to the length of time, we really, really, truly don't know the length of time. But if you had coronavirus and just say your 3 months is almost up or your 3 months expired, there are some things that you can do to give you some immunity against coronavirus. And that's taking the vitamin D. I recommend at least 5,000 international units a day. Taking quercetin and vitamin C. Very, very important with those two, because what they notice with the quercetin, it basically blocks the virus from being able to enter your cells. So making sure you're taking some quercetin. I used to say if your BMI is less than 25, take about 250 milligrams of quercetin a day. If your BMI is greater than 25, take 500 milligrams a day, along with the vitamin C, because the vitamin C basically helps keep the quercetin circulating in the body for prolonged periods of time, so it can be active against the virus. So those are some things that you can do in the meantime. I recommend 1,000 milligrams of vitamin C a day. So doing that, and that'll help give you some immunity. Oh, and also the medication ivermectin. No, I can't forget about ivermectin. Ivermectin is like a godsend right now as well, too. But ivermectin is a prescription drug, so you have to get that from your PCP. But they've done studies with ivermectin that was like totally phenomenal. Whether young, old, it didn't matter. But ivermectin was shown to basically prevent people from being able to contract the coronavirus. So that's something else that you can do as well. Yeah, I wanted everybody to say, she said shalom. So thank you. It says, can acid reflux cause mucus? Acid reflux itself doesn't cause mucus, but what acid reflux is basically the stomach contents that should be in the stomach. So if we think about it, you have your mouth, right? And you swallow. The food contents go down the esophagus. And then there's a little flap. It's a sphincter there. They call it a sphincter. It's a flap that once it comes down the esophagus, the flap is supposed to open and then deposit into the stomach, where everything is broken down, digested, and with the stomach contents. But after it goes into the stomach, that flap is supposed to close back down. But for some people, that flap is weakened. And a lot of different things can weaken that flap. Coffee can weaken it. Any type of caffeine. So whether you get it from soda or tea or peppermints or chocolate, even spicy foods, real spicy foods, and not talking about like spices and herbs, but spicy hot stuff like cayenne peppers and all those hot peppers, jalapeno peppers, that can weaken that sphincter. And if that sphincter is weakened, what ends up happening when it should be closed, it opens back up, allowing all that gastric content to come back up through the esophagus. and back into the back of your throat. So you feel like you coughing, you think you coughing up mucus, but you're truly just coughing up gastric content. And that over a period of time, a prolonged period of time, is also very dangerous because it's very acidic. So it can start burning holes in the esophagus. So you definitely want to get that taken care of. People who have issues with reflux, I would say there is a particular supplement that out there that you can purchase called Mastica. Mastic gum as well is another name of it, but Mastica, it's a old herb that's used, and it have excellent results for acid reflux, even H. pylori infections, and gastritis. So that's something that you can do to help, and also remove the causative agents, right? If you're struggling with acid reflux, decreasing the amount of coffee that you have, decreasing the chocolate and the other caffeine-related sources and the spicy foods, and you'll notice significant improvement. Other thing is people who are overweight, they also tend to have acid reflux as well too. So shedding some pounds actually help also give some relief to acid reflux. Oops. Hold on one second. Hold on. So Monique says, if she tested positive for COVID, can she catch it again? Yes, you can. And the reason being because the antibodies aren't sticking around forever. So you can catch it again. But if you tested positive and you're talking about it, that means you survived it. So no fear, right? No fear. Fear is not even necessary. Someone said that they've been sharing the thoughts and words but falling on deaf ears. Why are people so stiff-necked and sheep-driven? The Bible says, people's hearts fail them because of fear. Anytime you have fear on board, people are not listening to sound truth. They're not listening to wisdom. Fear is guiding them. That's why the Bible said God has not given us a spirit of fear, but what did he give us instead? He gave us power. He gave us love, and he gave us a sound mind. So if he had to give us a sound mind, if you think about fear don't allow you to have a sound mind. You can't process information correctly. You can't think straight because fear is driving you. And the Bible says fear brings torment. So think about that. If people are making decisions out of fear, they got torment coming on the other side of that. So when you have people who are full of fear, they're not thinking straight. So it's like to think that they're going to receive truth at that time, is up for grabs. But we got to continue to do our job, to continue to keep sharing truth, and just trust and believe that at some point, God will circumcise their ears and they'll be able to hear what the Spirit of the Lord is saying. Sherry said her husband is having Raynaud's. Oxygen level is low, is in significant pain. He has history of PAD and anemia. Could COVID be impacting this? If your husband has Raynaud's and he also has a coronavirus infection, yes, coronavirus can make it worse. What we have been seeing with people, some people, when they get coronavirus, for whatever reason, the whole inflammatory response, it does trigger issues with circulation, as well as development of blood clots and things of that nature. So yes, COVID could impact it. But he need to follow up with his primary, because if he, have severe circulation issues, he need to be on some medication that can help with his circulation. He need to be doing something. So he need to follow up with cardiovascular or somebody to restore blood flow. Sonny, if you can let me know who is the her you're referring to, I'll be happy to answer your question. Everywhere says, if you have a loved one hospitalized with COVID and you could not be there, what would you advise them to tell the doctor regarding their treatment? Should they ask for certain drugs and treatment? So, this is one of the reasons that I really want everybody to really rise up in truth and rise up in power, because this whole schematic is going on. It's so demonic on so many levels. Unfortunately, they changed the standards of care. And when they change the standard of care, they're introducing all these experimental drugs. A lot of experimental drugs are being used on people. And unfortunately, you have some healthcare professionals that's going to follow whatever the standards of care are, and whatever guidelines is put out before them. So even if you ask to say, don't do this and to give that, they're not going to do it if it's not according to their guidelines that they have. Some of the hospitals also regulate what healthcare professionals can do. So it's not like they're free agents in there. The hospitals are dictating to them what they can do and what they cannot do. So it gets very tricky once you get in there. And just remembering, during the beginning, at some point in time, when people the family members and the patient said they wanted to have full code status, which means that if their heart was to stop or they stopped breathing, that they wanted to be resuscitated, the hospitals were able to override the family decision and the patient decision, and they were not resuscitating people. So once they get into the hospital, it gets real, it's a gray area, it gets real tricky. So that's why I'm here to advocate for you now and to give you information now so we can shut it down so you don't have to get into the hospital. Typically, how coronavirus has been operating, that first week you get it, you have your symptoms, not bad, but typically by that second week, so come day 7, come day 8 is when the whole cytokine response triggers up, kicks up and go into high gear and people start having situations. But that's why if we shut it down early, you ain't got to worry about it. So do the things we talked about to prevent it. And like I said, if you end up getting diagnosed with it, taking higher doses of the vitamin C, quercetin, and D helps, but also getting that ivermectin on board. Then that way, all that stuff shut down the cytokine storm and you won't have the issues where you need to go to the hospital. Say, do I recommend almond milk? Almond milk is fine if, I just no cow's milk or animal's milk. But if you do almond milk, like I said, make sure you read the label. You don't want anything with carrageenan in it. So carrageenan is something that kind of help thicken it up or whatever they use, but it's very inflammatory and has been linked to causing cancer. So just make sure you read the ingredients when you buy an almond milk and make sure there is no carrageenan in it. And I be misspelling carrageenan. It may have 2 R's or 1, but it's like CARRAGEENAN, something like that. But if you read it, you'll see what I'm talking about. So Jimmy Lee wants to know if ivermectin has not been proven by FDA to help guard against COVID-19, how can we get it from our primary doctor for this purpose as opposed to from taking an mRNA vaccine? So for one, the mRNA vaccines are not FDA approved. FYI, they are not FDA approved. Only thing they have is what they call an emergency use authorization, and that is it. So they are not FDA approved. They just got an emergency use authorization. And in regards to the ivermectin, right now, they haven't been threatening our licenses if we prescribe it, so it should be prescribed because as healthcare clinicians, we're able to do what they call off-label use. So use medications for other reasons other than what it was originally, credentialed for per se. And then the other thing, NIH actually came out, the National Institutes of Health actually came out and what they said that they don't necessarily recommend for or against ivermectin, but they're going to leave that decision between the patient and the patient's provider. So even with that information, healthcare providers can prescribe it for their patients if they want. So Shania said, hello from California. How can you boost children's immune system? Children get children around children. That's one way to boost children's immune system. Children's immune system, when they're around other children with all their cooties and stuff that they bring, and they're getting that exposure that way, that's helping to boost their immune system. So getting children around other children, getting children back in school is one way to help boost their immune system. The other thing is giving children a good vitamin, like with some vitamin C in it, some vitamin D in it is definitely good for children as well. The other thing too is cutting back on that sugar. So if you want kids to have a healthy immune system, you got to cut back on that sugar. So sugar can come in many shapes and forms, whether it's from fruit juice, whether it's from snacks, whether it's from desserts, cookies, candy, you name it, is all out there. So cutting back on sugar can also help boost their immune system. But the main thing with kids, you got to get them around other children. They have to be around other children. Like I said, a good vitamin, probiotics is also really good to help boost kids' immune system too. So giving them some probiotics, some vitamin D, vitamin C will be excellent for kids. So are there different lab tests that can tell us what vitamins we are deficient in? Yes, it is. There's a lot of different labs that you can use. Some standard labs or whatever that you can utilize in a regular clinician's office. Then there are also the functional medicine labs that actually look even at a greater detail. So the answer to your question is yes. Can you talk about how a healthy immune system is more reliable than most definitely, 100%. If we think about it, so I would tell you, I would venture out here to say the majority of people don't have healthy immune systems. I would say that. Just being a healthcare clinician myself and seeing people and their immune systems and what's going on inside of their gut and their intestinal health, a lot of people don't have very healthy immune systems. But even in the of knowing that a lot of people don't have healthy immune systems, with the coronavirus, we still have greater than 99% of people who had the virus recover from it. So whatever the state of their immune system is, that immune system was very, very effective. So if we look at the vaccine is not 100% guaranteed to give you immunity. The Moderna vaccine was only at 94.1%. The Pfizer vaccine was at 93, but Moderna said 94, so they came back and said 95%. The other ones coming out, AstraZeneca, Johnson & Johnson, one was like at 60%, another was at 90%. So they're not 100%. So just because you get the vaccine, that does not mean you're going to have immunity against coronavirus. But it does mean you're going to have whatever side effects and whatever adverse events that comes from that vaccine. So that's why I say stay away from the vaccine. But if you boost your immune systems up and do things that we talked about before, like the vitamin D, the quercetin, the vitamin C, staying away from dairy, drinking plenty of water, managing your stress and getting some sleep, that's how you aid in boosting your immune system to get healthier. So that way, when you're exposed to coronavirus, you won't be infected. And if we think about even the numbers, everybody in America would have been around somebody, but everybody in America ain't got coronavirus. So it's not like, it's some widespread thing like that. So just keep that in mind. So boosting your immune system naturally will give you a lot more protection than the COVID-19 vaccine, 100% hands down. Sharon, I'm not for sure what you're asking, but based on your medical history, I strongly advise you not to get the vaccine. Based on your medical history, this vaccine can be very, very deadly for you. So please, by all means, do not get the vaccine. So LC wants to know if you're experiencing anxiety, what natural remedies can you take to cope and sleep better? One of the natural things is something called GABA, and you can get that from a health food store or a vitamin store. The dose is usually about 500 milligrams, but GABA is something actually that our body produces on its own. So just taking some extra GABA is known to help with anxiety. It helps to calm you down. It helps to relax you. And then also melatonin. Melatonin is also something good that our own body produces, that taking some extra melatonin can help you sleep. But the other thing, if you're experiencing anxiety, that can be multifactorial of what's causing that. But the healthier your gut is, your intestinal health is, the better you would be when it comes to anxiety. So there is this connection between the brain and the gut. So the healthier the gut is, the healthier the brain is, the less anxiety, the less depression you'll have. Something vitamin D definitely helps with that. But the other things we have to think about when you're talking about anxiety, what I say is remove the things that triggers it, right? Stop watching the news. get off of social media, and truly allow yourself to get before God. If you are a child of God, go before the throne of grace and just sit there and allow God to remove that heavy burden. He said, to cast all your cares upon him because he cared for you. So cast your worries, your anxieties upon the Lord and allow him to wash you with his word and with his peace. And that can definitely calm all storms. He told us, don't be anxious for nothing, but by everything with prayer and thanksgiving, make your requests known unto the Lord. So he tells us we don't have to be anxious because he's going to take care of us and he cares for us. So that's something else you can do. And if you're not a child of God, I highly encourage you to receive Jesus Christ as your Lord and Savior so that you can tap into those benefits of being covered, of being cared for. So you don't have to worry about what may happen. The world beneath us can crumble and shake, but our God is mighty. His word is our strong foundation and we'll still be able to stand. So just meditating on God. I also recommend turn the TV off at a certain time, like usually an hour before you're ready to go to bed. So that way you can begin a nice wind down routine. Prayer and meditation is amazing. Reading a good book that actually fuels your system is amazing. And that'll definitely help you with some rest. Okay, I got time for maybe a couple more questions and then that'll end it for today. Let me see. Yes, the common cold is caused by a form of coronavirus. So, and even with those tests, just FYI, those tests are not 100% accurate. And there's a lot of false positives with these tests. So I say stay away from the tests because they don't want you to be treated anyway. So if you're feeling sick, just go take the treatment that we talked about and you should be just fine. Sharon, for that particular question, honestly, I would recommend calling my office and setting up a consultation because it's deeper and it's not a one-size-fits-all approach. Abby wants to know if there's a way you can tell if COVID test results has not been manipulated. No, there's no way we can tell, but we do know that it does yield false positives. So that's something that we do know. So especially if you're asymptomatic, you shouldn't even be getting a test. If you're asymptomatic, I would definitely recommend not getting a test. But there has been some great studies that came out in 2 different countries. One was in China, and I forgot where the other one was at. I want to say Paraguay, maybe. But what they saw is that people who are asymptomatic did not transmit the virus. And even the World Health Organization, the person that's over the zoonotic pathogens, she herself even said it's very, very rare, if at all possible, that asymptomatic people can transmit the coronavirus. So just keep that in mind. If you're asymptomatic, the likelihood of transmission is slim to none. What can you do legally to not take the vaccine if your work requires it? One thing you can do is go to your pastor because they did use aborted fetal cells in this vaccine. But you can go to your pastor, get a letter from your pastor saying that it's against what you believe as a church, and that can give you some protection. Also, if you got any history of allergies, you can go to your primary and then you can get a letter from your primary because of your history of allergies, because what they're noticing is that people who had a history of allergies are the ones that are having anaphylactic reactions, including death from the vaccine. So if you got a history of allergies, that'll also give you a pass. All right. I feel bad because there's some other questions here. I'm just going to kind of run, but not put them on. Is turmeric good for you? Yes, turmeric and curcumin is good. They're excellent anti-inflammatories. Just remember with turmeric, you'll have to add some type of pepper, black pepper, or something like that, because it actually increases the potency of it. So that's good. Will ask description be met with a hassle? Depending on where your PCP is. So everybody's at different places along this journey. If you live in the state of Michigan, I'll be more than happy to prescribe it for you. If you don't live in the state of Michigan, you can fly into Michigan and I'm more than happy. All right. One last question. Why is the media pushing people to wear two masks? Oh, we already know, fear. So with this whole thing, before they rolled it all out, they went and partnered with certain schools, including Yale University, to get into human behavior to see what did they have to do to make people more apt to want to receive the vaccine. So they talked about all types of tactics. They talked about the whole fear tactic. They talked about the whole tapping into your compassion to make it seem like you're doing something for the greater good if you get the vaccine. They talked into about all that stuff. So initially, you got to remember, these same people saying wear two masks now was the same ones as U.S. Surgeon General, Dr. Fauci, in the beginning saying a mask didn't even help and you didn't even have to wear a mask. So you go in from not having to wear it to wearing two. And Dr. Fauci know about coronavirus. Like I said, he's been manipulating this virus for years. So he knows exactly what he's doing. And people have been wearing a mask and the masks don't work as we see the numbers going up. So don't wear two masks. It's just part of their fear mongering things to try to get people to get this vaccine. But don't do it. And yeah, don't do it. It's just ridiculous. All right. So let me see one last question and then I'll be done for today. But I'll be here on Fridays as long as you guys got questions. Hopefully I'll have some answers. I'll try to be on here at noon so people don't have to guess what time I'm jumping on. Noon every Fridays, usually for 30 minutes, live Q&A. And whatever I can do to help navigate you through this pandemic, to live not only victoriously, but to enjoy your life and also to thrive through it. Just know at the end of the day, you don't have to be sick at all whatsoever. It is definitely not a death sentence. It's not what they said. So don't buy into the hype. Don't even believe it. Do the things we're talking about here and you'll be just fine. Oh, thank you. This is how you spell it. Thank you, Jay Renee. I appreciate that because I told you me and my spelling, but that's how you spell it. All right, one last question, and then we'll get out of here. This question here says, the gummies, do the gummies work? I usually don't recommend gummies. And the reason why I don't recommend gummies is because they have a lot of sugar in it. Sugar in itself is very inflammatory as well. Some gummies also use artificial colors and flavors. So I usually don't recommend gummies. A lot of vitamins now you can get it in liquid form if you have an issue with swallowing it, an actual pill or capsule. So I usually recommend that, but not gummies. Because like I said, too much sugar in the gummies. But I thank you guys for your time. Like I said, I'll be here every Friday. As long as you got questions, I'll be here to have some answers, hopefully. But in the meantime, stay healthy, stay well, stay safe, be empowered to live and thrive in the midst of a pandemic. And know at the end of the day, you don't have to be sick, and stay away from that vaccine. Much love to everybody. Enjoy your weekend. God bless.